infertility is described as the inability of a man to cause pregnancy in a fertile female. There are no telltale signs of this, and a startling number of cases in which couples are unsuccessful in conception is due to male infertility. In this first of a two-part report, we visit the IVF and Fertility Centre and learn about this silent impediment. Here's Reagan Des Vignes.
This is a beautiful birdie. This is a handsome bumblebee. When two people really like each other, they fall in love. They look into each other's eyes, hold hands, and go out for a romantic meal. Then they find a home together and fill it with lovely memories.
We've all heard the story, right? It's the birds and the bees, a story of sex, the act of procreation between a man and a woman which results in the birth of a child. Sounds perfect, right? Well, in the real world, there are challenges.
Infertility is if you've been trying for a baby and it hasn't happened, and you look at the length of time, and most places will say about a year. Sometimes if you're older they'll say 6 months trying and then it's infertility, and some countries say 2 years. But generally people say if you're a man and you've been trying with your partner for a year, you don't have to try at a specific time and be perfect, but if it's not happened over a year, then that's infertility.
This is Dr. Bain, and she is the director of the IVF and Fertility Clinic at Rookery Nook in Maraval.
It's one of a chain of clinics in Trinidad and Tobago that provides fertility services, fertility advice, tests, investigations and treatments for couples who want to have a baby.
According to the clinic, infertility in men in TNT affects about 50% of the cases where couples have trouble getting pregnant naturally. But the reality is that number is likely to be significantly higher.
What we know here, if you compare to working in a clinic here compared to working in London or the UK, what is absolutely obvious is that there are more problems here for women and for men, and that covers a range of things: polycystic ovaries, diabetes, we are more overweight, we have a lot more issues, infections, so that affects all sorts of things. But male infertility, you see many more problems here than you do in a clinic in the UK, and more severe problems.
Modern medicine believes that several factors can impact the health of a man's sperm, such as diet, genetics and environmental elements. And you'd be surprised to know that human sperm can be affected by quite a few elements. One group of men is particularly at risk.
So the first thing we did was we plotted out on a map of Trinidad where all the sperm tests men lived, and did the low sperm counts or men with no sperm cluster in certain areas? Did they cluster near certain industries? And the answer was no, they didn't. And then we looked at ethnicity. So the second question is, we know we're a multiracial society. Does it cluster in certain people? Absolutely not. It goes across social class, ethnicity, doesn't matter where you live, your job's not really important, industry in your area isn't. Ages. The one thing that showed up that we know worldwide is that as you get older, your sperm count gets less good.
On our next installment, we'll show you the process of sperm testing, and we'll give you the scoop on what can be done to reduce your chances of being affected.
You go about an ejaculation with the use of visual aids. We have some magazines here that you can use to assist you.
Whoa, are you serious?
For C News, this is Reagan Des Vignes.